Hi. So I'm going to be administering medication to Millie Larson. The first thing I want to do is to make sure I have the right patient by doing at least 3 checks. So then I would introduce myself. Hi, I'm Farah, your nurse. I'll be giving you your med. Can you please state your name? Millie Larson. Hi, nice to meet you. And I would look at the MAR, and again, it does say Millie Larson. I'm going to look at her bracelet, and it does say Millie Larson. And can you state your date of birth? 1136. Good. And I'm looking at the MAR. It also says 1136. The other thing I want to do is to make sure she has no allergies, and her bracelet tells me no allergies. And then the MAR, it said no allergies. So next thing I'm going to do is to wash my hands. She's the only one in the room, so privacy is accounted for. And after washing my hands, then I would get my gloves. Okay. And then again, I'm just going to look at the MAR, which it's saying Millie Larson. It's scheduled for furosemide, 20 milligrams IV push. And it is to be administered over 2 minutes. Has a 3 ml flush before and after. So I would let her know that I'm going to be giving her medication in her IVs and IV push. I would also let her know that she is due for her insulin, Lispro, 10 units subcute. So I've done a couple checks, the right patient, and the right time. So first thing I'm going to do is to administer her insulin. I have a regular insulin syringe. So I'm just going to remove the syringe. And then I have a garbage easily accessible, so I'll just toss that in my garbage. And then I have 2 containers in front of me, and I'm gonna pick this one. I'm gonna look at the vial, and it does say insulin Lispro, and the expiration date is October 2027. While I'm doing that, I'm also gonna look at the MAR again, which does say Millie Larson 1136 is scheduled for insulin Lispro, and I'm just going to look at her name bracelet, Millie Larson 1136, due for her insulin. So I'm just going to remove the cap and discard it. And I'm just going to lay it on a flat surface. I'm just going to get my alcohol, and I'm going to just clean the top real well, just for these 5 to 10 seconds or so. Give it a good rubbing. Okay, then I'll discard this because I clean the vial. And then I will get another alcohol, and I will just let her know that I'm going to be giving her 10 units insulin, and I'm actually going to do it in the upper, like the back of her arm right here. I'm going to pinch it when I do it. So I'm just going to clean the area real well, like circular to out. And then I'm just going to leave the alcohol like on the perimeter of the area that I just cleansed. And I'm looking at the MAR again where it says Millie Larson 1136. It's due for insulin Lispro 10 units. And so I'm going to just look at her bracelet again, which says Millie Larson 1136. So everything matches. I'm going to get my needle, remove the cap. We need 10 units. So I'm just going to pull down to 10 units. And again, I'm just going to look, making sure that I'm going to be pulling up the correct insulin, which is Lispro. And it does say insulin Lispro, 10 units, and also the MAR. So I'm just going to go on a 90-degree angle. So it's all the way down, some air. And then I'm going to go turn it this way, and I'm going to pull up 10 units insulin. And then I'm just going to pinch the area while I look at the Mara again. I look at her name, look at her bracelet, and then I'm going to pinch it, let her know. And I'm going at a 45-degree angle. So I'm just going to go like this, pinch right in, and then inject the insulin. And then as soon as I'm done, I'm just going to put the safety guard, dab the area, and so I'm going to discard it. And I'm also gonna mind her. And one more medication that we have to do is the furosemide, 20 milligrams. It's an IV push, and so I want to make sure I'm gonna take my insulin and just put it over on that side, and then I'm looking at the furosemide order for 20 milligrams IV push. 20 milligrams, according to the math, is 0.02 ml. And so I'm looking at furosemide, the 20 milligrams, and I'm also going to look at the expiration date, which is October 2029. And I'm just going to remove the cap and just place it on a surface. And then I'll get my alcohol, and I'm just going to clean the area real well for at least, 10 seconds or so. And then I'm gonna discard. And then there's an order for a 3 ml flush prior to, but before I do the flush, I do have my needle, which is a 3 ml 3 ml syringe is what I want to say. And I'm just going to discard my garbage. And I have a 25 gauge, and so I just want to, and while I have it like this, I just want to snap on my needle. And that's discarding my easily accessible garbage. I've already cleansed. And then what I'm going to do is just remove. Just going to remove the cap, and it's 20 milligrams, which is going to be 0.02. So I'm just going to pull down 0. It's a very small amount, 0.02. Put it to eye level so I can see. And then I'm going to just go down like a 90-degree and put air, and then I'm going to turn it this way and bring down 0.02. Okay, and then I will no longer need the needle, so I'm just going to do the safety cap, and then I will just snap it off, put it in the sharps container, and with my needle, I can just hold it here in my hand, and I still have my dominant hand, and I'm going to use my alcohol, and I am going to cleanse the tip real well. I want to clean it for a good 5-10 seconds. So I'm going to clean it for 5-10 seconds, and after I do that, I have my my saline, which is the flush is 3 ml, and so discard, and then I am going to do 3 ml flush. And so I'm going to do 3 ml flush, no resistance. Very good. And then I still have, I will discard this. And then for her furosemide, before I give this furosemide, I'm looking furosemide 20 milligrams, Millie Larson 1136. And again, I'm going to look at her bracelet, Millie Larson 1136, no allergies, scheduled for furosemide 20 milligrams, which is 0.02 ml. And it's to be infused over 2 minutes. And so I'm just going to go real slow. And while I am waiting, infusing slowly over 2 minutes, I would ask her how she slept last night. How is she feeling? Does she have any pain? So we would have, talk to her, interact with her, ask her if there's anything else that she would like before I go. If she's having any pain, and tell her I will see her tomorrow. So then she would know when she's gonna see me again, but she can always call me. So it's being infused slowly and slowly and slowly. And that is about it's about 2 minutes. And then I would just unsnap, discard, and then she's due for another 3 ml flush. So with my dominant hand, then I'm going to be administering 3 ml. So then I would do a flush, 3 ml. Okay, 3 ml. And then I would just put the, make sure everything's back in place. Okay, and then that's it. Then I would just throw out any extra garbage. Remove my gloves. Wash my hands. And after washing my hands, I would make sure she's in a comfortable, safe place. Ask her if she wants me to turn the TV down, turn it off, open the blinds, and I would give her her call light and let her know that she can call if she need anything. And then I would document on the MAR, which is right here, that I did give Miss Millie Larson furosemide 20 milligrams IV push of 0.02 ml. So I would document, and her insulin, 10 units was given as well. And I would document that, and I would tell her, have a nice day. See you later. Okay, thanks.